No single liver function parameters will tell about the entire story. The key is recognizing the pattern across the entire panel. For example, this will be the ALT and the AST. Usually the AST, ALT elevations may be graded as a mild, moderate and severe. Whereas the mild and moderate elevations may occur in all the disease. Example in viral hepatitis, and, metabolic dysfunction associated liver disease, alcohol liver disease, drug-induced liver disease. In a severe liver dysfunction, that is a marked elevation of AST elevations that come around will be more than 1000 elevations. Will have specifically indicate that will be the severe acute alcohol hepatitis or the severe acute viral hepatitis, drug-induced liver injuries. Especially in the AST-ALT ratio, it indicates that is normally 2:1. The high ratio indicates that is alcohol liver disease, whereas the AST-ALT ratio is 1, indicate a non-alcohol liver disease. There are so many tests available, especially for other than the AST-ALT elevations, the synthetic functions. Synthetic function, especially for the liver normally produce that is proteins, that is especially the albumins. And estimate the albumin level, it gives us the normal function level. Whereas there will be this decreased level of albumin as well as a coagulation parameter indicates a chronic liver disease. We are living in the technology world, whereas there will be the diagnostic evaluations coming up with the early detection biomarkers, especially for to detect the early changes in liver injury, steatosis and fibrosis with the blood biomarker, microRNA. The microRNA 122, microRNA 34 are useful to detect these early changes of the liver dysfunction, especially for the steatosis, fibrosis and things. Second, the matrix remodeling markers MMP and TAMP are useful to detect that will be these chronic changes. That is especially the fibrosis in the early stage. Third is for the hepatocellular carcinoma biomarkers. Beyond that is routine evaluation of alpha-beta protein. Now we are coming up for early detection of hepatocellular carcinoma with osteopontin, and the GLAD score will clearly indicate that will be the hepatocellular carcinoma in metabolic associated liver disease as well as will be in the alcohol related liver disease. In general, the screening should be focused on in the high risk group than the general populations, especially the patient with that alcoholism or a metabolic dysfunction associated liver disease. The routine liver functions, the LFT, metabolic profiling, and liver imagings must be needed at a regular interval. Second, it will be the non-invasive tests are very much useful. That is PIP4, ELF score, NFLD fibrosis is useful for detecting the high risk groups. in laboratory based test where we follow that is automation, better specimen transport will have good results. By way of standardizing the pre-analytical handling will reduce the delays as well as decrease the preventable errors like hemolysis, poor storage, or will be the processing variabilities. Second will be point of care testings are very useful and also is highly sensitive. You can use it at the bedside at rapid blood tests so that it will have detect the disease progress as well as prognostication also estimated by this point of tests. Finally, we must have advocate or follow that is the AI-driven algorithms for early abnormal patterns of liver dysfunctions.